Hi, Julia. My name is Carmen, and I'm going to be doing your head to toe assessment today.
Okay.
Can you tell me your name and your birth date?
Yeah, my name is Julia Monti, birthday 12/17/1996.
And where are you and why are you here?
I'm at the hospital and I'm here because I have a stomach ache.
Okay, so before we get started, I'm going to wash my hands. I'm going to check your vitals. I'm going to check your temperature, your blood pressure, your O2 saturations, your respirations, and your heart rate.
Okay.
So as we go through the assessment, I am basically just going to be checking your skin for any rashes, lesions, breaks, the color of your skin.
Okay.
But first, I'm going to check your skin turgor.
Okay.
So I'm going to pinch a little bit, and there's no tenting, which means you're hydrated.
Okay.
And I'm also going to palpate your head.
Okay.
So I'm just going to look and see if your hair, there's an even distribution of your hair, if there's any like bumps or anything like that, and everything looks normal.
Okay.
So the next thing that I'm going to do is I'm going to palpate or just feel for any tenderness on your frontal sinuses.
Okay.
And your maxillary sinuses. Is there any pain?
Mm-mm.
Okay. And so I'm also going to check your ears for symmetry and color, and they look normal, no tenderness.
Mm-mm.
Okay. And I'm also going to touch your nose. Is there any tenderness on your nose?
No.
And your nose is symmetrical. So now I'm going to be feeling your lymph nodes. So we're going to do the pre-auricular, your post-auricular, your occipital, your jugulo-digastric, your submental, submandibular, your posterior chain, your deep cervical chain, and the front cervical chain. And then your supraclavicular. Okay. Is there any pain or tenderness when I was doing that?
No.
Okay, good. Okay, so now I'm gonna just check your cranial nerves.
Okay.
Okay, so cranial nerve number 1 is your smell. And I'm just gonna have you plug one of your nostrils and just smell. And then the other one, smell. Can you smell this?
Yes.
All right, good. And then cranial nerve number 2 is your eyesight. And so I would have you do the Snellen chart. So you would cover your right eye and read the lowest line that you could read, cover your left eye, read the lowest line that you can read, and then you would uncover both of your eyes and read the lowest line that you can read.
Okay.
And then we're going to do cranial nerve 3, 4, and 6. So I'm just going to do some check some things with your eyes.
Okay.
So the first thing that I'm going to check is called accommodation. So what I'm going to have you do is I'm going to have you look at my pen light and then look behind me.
At the window?
At the
Okay.
window. Yeah. So look, and then look at the window, and then look at the pen light, and then look at the window. Good job. Okay, and your eyes are accommodating. And the second thing that we're going to do is I am going to just shine this light in your eye so I can see your pupils if they're round and reactive to light.
Okay.
Good. And yep, they're round and reactive to light. And then the last thing that we're going to do is I'm going to have you stare at my pen light, and then I'm going to have you follow it, and I'm going to move it different ways.
Okay.
Okay. Good job. Okay, so the muscles in your eyes are working well. The next thing that I'm going to have you, or that we're going to do cranial nerve number 5, and that is just your sensation.
Okay.
On your face. So what I'm going to do is I'm going to touch the Q-tip part on your face, and I want you to say soft and where it is, and then I'm going to touch the harder tip, and I want you to say if it's hard and where it is.
Okay. Forehead soft. Cheek hard. Cheek soft.
Good job. Okay. And the next one is cranial nerve number 7. And so I'm just going to ask you to smile and squint your eyes really hard, frown, puff your cheeks out. Good job. Okay. Cranial nerve number 8 is I'm gonna do a little exercise with your hearing. So I'm gonna step behind you and whisper 3 words in your ear, and then I just want you to repeat the words to me. Okay.
Dog, kid, play. Jump, run, fun.
Good job. Okay. And now we're going to do cranial nerve number 9 and 10. So I'm going to have you open your mouth and go, ah. Yep. And your, you can see your uvula is midline and everything looks good inside your mouth. I don't see any lesions or anything. So now we're going to do cranial nerve number 11. So I'm going to have you shrug your shoulders, and then I'm going to have you like put resistance on my hand this way and then this way. Good job. Cranial nerve number 12, I'm going to have you stick your tongue out. Your tongue looks great and it's not deviated. Okay, so now we're going to move on to respiratory. So I'm checking for your respiratory rate and any like distressed breathing. I'm going to check your fingers for cap refill, and it fills up in 3 seconds or less, so that's great. I'm also going to check it on your toes. Yeah, and that looks great. And then also your hands for clubbing, and I don't see any clubbing in your fingers, so that looks great. So I'm going to have you, I'm going to have you turn this way because I'm going to have to check your chest expansion. And so I'm going to put my hands right at the base of where your lungs are, and I'm going to have you breathe. Yes, good job. Okay. And now I am going to check for tactile firmitis. So I'm going to have you, each time I move my hands down your back, I'm going to have you say 99.
Okay. 99, 99, 99.
Good job. Okay. And now I'm going to percuss over your lung fields. So we're going to do up at the top, middle, and lower lobes. Okay?
Okay.
Good job, Julia.
Thank you.
Okay, everything sounds good. And now I'm gonna auscultate your lung sound. So every time I move my stethoscope to a new spot, can you take a deep breath for me?
Mm-hmm.
Okay, so we're gonna do upper, middle, and lower lobes. Good job. Good job. Good job. Okay, and I don't hear any advantageous breathing. Okay, so now we're going to move on to respiratory. So I'm checking for lifts and heaves. Actually, I'm going to have you lay down for this. Okay, so okay, can you like scoot here? Scoot a little bit. There we go. Okay, now I can see. Okay, so the first thing that I'm going to do is check for lifts and heaves, and then for thrills. Okay, and I don't feel anything abnormal. And now I'm going to check your carotid artery. I'm just going to palpate for this for right now. Okay, and your radial pulses. Good job. And then can you lift your feet up for me a little bit so she can see that I'm checking the pedal pulses. And I'm also checking for edema, and I don't see any pitting edema. Okay. Next thing that I'm going to do, Julia, is I'm going to auscultate your carotid artery. So I'm going to do it with my bell. So I'm going to do it at the jawline and hold your breath. Thank you. And then I'm going to do it the mid-cervical, and then I'm going to do it at the base of the neck. Good job. And now we're going to listen to your heart sounds. We're listening for sounds S1 and S2. And your aortic, I'm going to flip my stethoscope around and use the diaphragm. So I'm going to listen for your aortic at the second intercostal space to the right. And then I'm going to listen to your pulmonic, the second intercostal space to the left. Erb's point is just one down at the third intercostal space. And then your tricuspid is the fourth intercostal space to the left. And then your mitral is going to be the fifth intercostal space. Okay, good job. Now we're going to focus on the abdominal assessment. And the first thing that I'm going to do is I'm just going to inspect and make sure that everything's symmetrical, that you don't have like concave or anything like that. And I'm going to listen to your your cardiac vessels. Okay, can you show me where your belly button is, Julia? Okay, so the first one that we're going to listen to is the aortic. I'm going to flip it over to my bell. And we're listening for bruits. Okay, so aortic, and then your renal, your iliac, and then your femoral. Okay, thanks, Julia. Now I am going to listen to your bowel sounds. So I'm going to auscultate your bowel sounds, and I'm going to start in the right lower quadrant. Listening for at least 5 bowel sounds. Okay. Perfect. Everything sounds normal. So now I'm going to percuss. So I'm just going to do some light tapping on your stomach. Okay, everything sounds normal. Now I'm going to I'm going to palpate. So I'm just going to like press on your belly first lightly and then deep. So making sure that I do it in all 4 quadrants. And now I'm going to do deep palpation all over. Okay, good job, Julia. Thank you. Now, Julia, we're going to do some musculoskeletal, like some strength exercises. So I'm just going to have you pull I'm going to do resistance and have you pull, and then I need you to push on my hands. Good job. And then I'm going to do the same thing on your feet. I'm going to have you push the gas pedal and then pull up on the gas. Yeah, there you go. Good job. Okay. So now I'm going to have you, I'm going to just check your hands for any like abnormalities or bumps or anything like that. And everything looks normal. And then I'm also checking your feet for the same thing. I'm checking for any abnormalities or bumps or anything abnormal, and everything's normal. So now I'm going to have you stand, and we're going to do some range of motion exercises. Okay. So I'm going to have you extend your head, and then flex your head. And then I'm gonna have you abduct your arms, adduct your arms, and then also your hips. I'm gonna have you abduct, and then adduct. Okay. And then we're gonna check for scoliosis. I'm gonna have you bend over, and I'm just gonna feel your spine. Everything feels normal. You can go ahead and stand up, and then I want you to extend your back. So go backwards. Yeah, there you go. Good job. Okay. And then I'm gonna have you walk over towards the door and then walk back, and I'm just checking for gait, and everything is normal. That concludes your head to toe assessment. Do you have any questions?
Are you going to listen to the front of my lungs?
Oh, yes.
Thanks. Just real worried about them.
I'm just gonna listen with the diaphragm. Here, here. And we'll go down here. Okay. Very good. Thank you.
All done. It didn't stop.